More next on Digital Jam. My next guest company combines internet technology with an information appliance to connect healthcare providers to their patients at home, with the idea being to reduce healthcare costs, particularly for those suffering from chronic illnesses. Joining me now to explain how the program works is the CEO of the Health Hero Network, Steve Brown. Steve, welcome to the Jam.
Thanks, Bruce.
First of all, unless you understand the problem, you don't understand the value of what you're trying to offer. What is the challenge here?
Well, healthcare is $1 trillion right now. Most of that is in the hospital. Most of that is for the complications of chronic conditions. We enable nurses and doctors to monitor patients and communicate with patients before they get to the hospital, between doctor's visits, and after they leave the hospital, hopefully to avert more serious problems.
Now, you're talking about things like home testing, adherence to certain medical regimes, like taking pills or things like that?
Conditions like diabetes or heart failure or asthma, chronic conditions that need to be monitored and managed every day. If you think about it, ambulances bring patients to the hospital after conditions have gotten complicated and usually too late to do the simple things. Information and communication with patients through Health Buddy brings people back in to the doctor for the right care at the right time.
All right, let's show our viewers what Health Buddy is. This, as you can see, it's not much bigger than a typical telephone, but this attaches to your telephone.
This plugs into your phone line, and it runs a dialogue that's assigned by a nurse. And the nurse, first thing that nurse wants to ask somebody is, how are you feeling today? And then another series of questions about your care. Are you having difficulty breathing? Do you have any shortness of breath? The other thing that Health Buddy does is you can plug in medical devices like blood glucose meters. In fact, we just got our 510K clearance from the FDA yesterday on the connection to a wide range of blood glucose meter. And so it's the first time that the connection to the internet between a range of medical devices has been cleared by the FDA. So now nurses can not only ask you how you're feeling and ask about symptoms and side effects and things like that, but they can also get biometric data out of medical devices and get that information in a very timely way so that they can intervene before conditions escalate.
Now, how are you suggesting that this can be used? Does this mean patients can go home sooner if the feeling is the patient can be adherent enough with this particular routine to produce monitorable results?
This means better care between visits and after you leave the hospital. A lot of times people leave the hospital with a next scheduled doctor visits for months down the road, but there are a lot of things that they're worried about and a lot of risks. If you stay in contact with a nurse and with a doctor, you can avert serious problems before they get worse. That's what we enable. So a nurse goes to our internet site to find out how their patients are doing. How are my patients doing in the last 24 hours?
So, it's not really the back end, but the nurses or in healthcare providers end, they can just take a look at the screen and see, well, this is how all of our patients are doing on a single day.
Right. Health Buddy synchronizes with our website every night so that in the next morning a nurse can see, how are my patients doing, all stratified by risk, who's in the red zone, who's in the yellow zone, who's in the green zone, who needs a follow-up, who needs a phone call.
Great. We're taking a look at the output right here. So we can, what in particular in this page is this page showing us right now?
This is an example of what a nurse might be looking at when the nurse comes in the morning. A list of her patients, and then clicking in on patients that are in the red zone to see what's going on with that patient. What's the trend over time? What are the symptoms? What is the data from devices?
Now, I bet you've tried this out in some trials with patients and doctors?
We have a number of customers that are up and running using it right now for things like congestive heart failure. I know the Mercy Heart Institute at Catholic Healthcare West in Sacramento is using it for their platform. They were one of our beta customers.
Do you actually have some results to say?
Our sites have found so far that, first of all, patients love it. They feel very connected to their healthcare provider. They feel like somebody's taking care of them, and they use it every day. 90% of the patients are using it every day, and nurses find that they can handle more patients more effectively by focusing on the patients who need it the most.
What is the cost to the patient here?
Patients don't pay anything. This is something you get from your health plan or your healthcare provider as a part of some kind of treatment program for your condition.
Has this been certified by insurance companies yet? Because they're the payers here.
We have about a dozen sites that have started to use the platform. Health plans like Pacificare and Empire Blue Cross, healthcare providers like Mercy, Catholic Healthcare West, and Santa Clara County IPA. So generally hospitals, medical groups, and health plans all have a stake in better communication with patients.
And Health Hero IPO anytime?
I think what we're doing will affect a lot of the cost of healthcare and is very important in healthcare, and we are trying to build a very significant business out of it.
All right. Well, Steve, we're going to have to leave it there, but thank you very much for joining us.
Thank you.
Steve Brown of the Health